Hello and welcome to the Demographicast, a podcast where we discuss politics and social issues with a variety of different guests. Today, Jack and I are joined by Dr Simon Rowbottom, who has a background in music, is a stay-at-home dad, and is a psychologist. We'll be discussing mental health issues, specifically in young people, and also the sort of services available in the UK. Simon, how are you?
I'm very well, thank you. Very well. Good to be here.
Jack, how are you?
I'm good, thanks. How are you?
Yeah, I'm not too bad.
Good.
Simon, I thought you'd sort of, if it was okay, if you could sort of start by giving us a bit of background as to why you became a psychologist.
Yeah, absolutely. The psychologist thing sort of happened to me quite late on in life. So I had, as you just mentioned, I had a first career as a musician, and then after that ended, I was a stay-at-home dad for a while, and I guess, sort of at the end of that, I was a bit lost when my children started to go to school. I was a bit lost and ended up in counselling to really sort of give me a kind of a view of what I wanted to do. And I think it came out of that, really. I mean, I'd always had an interest in psychology. I'd done psychology at A level sort of 20 years earlier, and then, but it was really the sort of it was really the counselling that I had that gave me an interest in wanting to sort of pursue it as a kind of practitioner subject. So,
Right.
so that's when I went back. I went back to university as a mature student at the age of 40, pretty much, and started studying then. So and never regretted it. I mean, I think it's a wonderful job.
Right.
Interestingly, my mum's just started a psychology and counselling degree as a mature student. Would there be any advice that you'd give just to people more generally about going into the profession or starting their studies? Just some things that I guess have stood out.
Well, I think there's a couple of things. I mean, I think there's two things there. One going in as a mature student is difficult. I mean, if everybody was if everybody else is younger than you, I think that has its own issues.
Sure.
But if your mum's kind of going into that training, I think the thing about that is that don't expect to learn everything in that course. You know, the learning really starts when you leave, when you're qualified. You know, essentially the training is to give you a grounding to be able to set off, and then you start learning. And the greatest learning is from our clients. You know, that's where all the learning is done, and as long as it's a kind of collaborative process, you will learn. You know, so and that's one of the fantastic things about it. You know, you're never bored, you never stop. There's always new things. There's always new learning to be done. So yeah, tell her not to worry about feeling like she's ready. She'll never feel ready.
Is it quite nerve-wracking having your first clients?
Oh, it's absolutely terrifying.
Yeah.
Absolutely terrifying. It really is. I mean, you know, these. I mean, it's good that the clients are kind of unaware, you know, of when we're sort of seeing clients. But yeah, I mean, you can do all the practice you like, and we do a lot of practice on each other and these kind of things. But first sort of, you know, hour with the client in the room is absolutely terrifying. You know, you sort of, you're well aware that, you know, this person has come to you for help. They're looking to you for to help them, you know, feel better, and it's a huge responsibility. So it's terrifying. But then, apparently, you know, really, you shouldn't ever kind of lose that. You know, you shouldn't ever really lose the nervousness, because the nervousness it's like going on stage. You know, it's a good thing. It means you're prepared. It means you're concerned about the client. It means that you're going to pay good attention. You know, if you're too relaxed, it just means you're not really that concerned. You know, you're not really that concerned about doing a good job.
Yeah. Mental health has seen quite a lot more sort of acknowledgement in the last few years, or last decade anyway, in society. I thought this question is sort of aimed at both of you, I suppose. Are you happy with how it's progressing, with how the progress that has been made?
After you.
Okay. For me, yes, because it is a work in progress. If it was to say where we are, probably no, because I think there are a lot of mixed messages out there. And I think the difficulty is probably that there are a lot of conflicting voices about what mental health is, what it should be, how it needs to be looked after. That's nothing new.
Sure.
There are something like 450 different types of therapy out there, so everybody's always had a different view of mental health. But I think it's now getting disseminated down to the general public, and I think it can be a bit confusing. There's no one message, and there's an awful lot of different views about mental health, and I think that can be a bit confusing for people at times.
Yeah. Do you feel enough has been done from a policy level to ensure that there is the availability for those who need it to access mental health services?
That's a really difficult question, because the effort has been made, but essentially I think it's come from the wrong motivation. So the biggest change in sort of mental health provision over the last 10 years, 15 years has been what's called improving access to psychological therapies, IAPT, and has different names in different regions. But essentially what that is sort of improving the immediate access to frontline mental health services. But what that essentially means is usually a very quick course of CBT, of kind of people being given self-help reading, people being given computerized CBT, these kind of things, which have their place. They have their place. But the problem is that when people contact services, it usually means they're in crisis. Those frontline things that are given are very, very helpful, and are very helpful in a kind of prophylactic kind of proactive way. But once somebody's in crisis, they're not really able to sit in front of a computer screen and go through kind of logical CBT stuff. That's where they need another human being, and that's where the access isn't good. But the problem is that policy, it's an economic decision. Rather than improving access to psychological therapies is about reducing sick leave through depression, and actually came out of a conversation between David Clarke. Apparently, I don't know whether this story is apocryphal. David Clarke was running the Oxford Cognitive Therapy Centre, I think, and he met Lord Layard at the opera, and they got talking, and one of these things was, he introduced Layard to CBT and the idea that in a cost-effective way, psychological therapy can be given to people, and thereby reduce kind of sick leave. But I think the difficulty is that once people get to that point that they're actually having to take time off work, then it's too late. It's too late for that kind of, and I think that's the problem. One of the things that I'd like to see out there as an understanding of mental health is that it's not a binary state. It's kind of, people will kind of think, okay, my mental health is good, or it's bad and I'm in crisis and I need help. But there are lots and lots of divisions beforehand, and I think that's where I'd prefer to see more access. That's where you're going to get the prevention. But I think we're a long way from that.
Yeah. Do you think a lot of it comes from also an educational standpoint, not just from as a society being more aware of our own mental health and others, but also from teaching about this kind of thing in schools and starting to gradually normalise discussions around mental health and reaching out and that kind of thing? Do you think that in many ways is as impactful as the policy-led solutions?
I mean, personally, I think that's exactly the case. I mean, I think that the problem with the mental health provision now is that it's reactive. So it only comes in when somebody gets unwell. I think that actually, if there was provision in schools to educate about this sort of thing, because for me, mental health is not an anomaly. It's a normality. It's a consequence of us living lives that we're not made for. It's a consequences of that we still have a caveman brain, not designed for very much more than kind of hunting, scavenging, staying alive, reproducing, and suddenly we've developed this neocortex that allows us to think, imagine, remember, create all these kind of things, and the world is just too overpowering for us. There's just too many. So for me, poor mental health is actually built into the society and the world we live. So that's kind of what I would want to see in schools. Absolutely an awareness of that, of kind of, look, we have to work to keep our mental health good. We can't accept that it's the norm, and if something goes wrong, there's something wrong with us. I absolutely agree. I think there's a huge amount. I think this is improving. I think there's sort of pastoral teaching in schools is getting better. I think there's an awareness on emotions. Mindfulness is being introduced to schools. But certainly I think it really, really, those things need to be absolutely part of the curriculum. And it's one of those things that actually it's a no-brainer, because if you can just introduce this curriculum, it will help enormously, I think, in 10, 20 years' time for people to know where to get the help, because this is the problem. The problem is that mental health needs to follow the example of physical health, which, physical health switched from being reparative to being preventative. And, so much of what physical health is about watching obesity, watching diets, not alcohol intake, exercise, all these things, and not smoking. And that's where mental health needs to go to. Mental health needs to go to fostering good mental health habits in people, awareness, how we need to tackle things, how we need to think about things. That will have much more impact, I think.
Yeah.
Do you think?
Sorry, go ahead.
Sorry, I was just going to say that. Do you think that sort of education from a young age, and the accessibility of services to help with mental health issues at a young age, would help the sort of common phenomenon that seems to be the case in the UK? At least I think that where people kind of find it it's a bit taboo to go and seek help. I think. I know I struggled with it as well, and I think people commonly do. Yeah, do you think that education would probably help with that?
I really hope so. Yeah, absolutely. I would like to see, it's seen as the norm, because there has been a stigma, because the reason that has been the case is that mental health is trying to escape the shadow of the medical model, which has been sort of built up through the early 20th century, that psychiatry took over the domain of mental health from religion. And psychiatry adopted the medical model, which is essentially, if you are suffering poor mental health, there is something wrong with you, and therefore that needs to be fixed. And this is where the stigma has carried over, this idea that there is something wrong with you. And therefore it generates a great deal of shame, and it's very, very difficult for people to access help publicly. It feeds into, for men, it feeds into ideals of masculinity, and this is why we see the male suicide rate so high. And so I think to reduce that stigma, I think the general level of introduction of kind of the mental health, poor mental health, is relatively normal. And I think that that's starting to happen. We're seeing it being normalized more and more. I think social media and kind of, I guess, celebrity kind of, I don't want to call it admissions because that makes it, but celebrities sort of saying, I've struggled with this. This is what's happened to me. I think is going through a process of normalizing, which obviously has to go through generations. We still have a sort of post-war generation around us who would never do that. I mean, there are people who during the war have been through some terrible, terrible things, which has undoubtedly damaged their mental health severely, and their take on it is that they have to stay silent and they have to stay strong and keep stiff upper lip, and that's kind of what we have to lose, and that will happen generationally, I think.
Yeah, I guess it's as you're sort of saying, a lot of these, whilst the tackling of this issue will take a long time, and destigmatization and normalization happens over generations. To go back to Brett's question, I suppose my personal view on the role that the government in particular has played in this is that there have been some positive steps over the last 10 years to try and tackle this issue, but it isn't yet good enough. The accessibility of a lot of services aren't at the level that they need to be, especially for young people, and this is a issue that year on year, like you said, with suicide rates is getting worse. You mentioned overstimulation of the brain. Do you think that is a key factor in young people's mental health with things like social media? Is it a case that society is moving forward so quickly, and maybe the accessibility of support and the support itself isn't moving as fast as the world is? Could that?
Yeah, I mean, I think that's a good way of looking at it. I mean, I think that, yes, for me, my view of mental health, and a lot of people probably won't agree with this, but comes from generally an evolutionary perspective. Right. And sort of the work that I sort of hold a lot of stock in is the work from people like Robert Sapolsky, who's an American biologist who looks at a lot of kind of primate studies and sees the impact of stress on primates and humans. And essentially, the overstimulation thing is what that amounts to is the body's stress response. Our fight or flight response kicks in when we are overstressed. Now, in our bodies are made for that stress response to only be triggered like that when there is an active stimulus in the environment. The problem is that we don't need that anymore. So if you're an animal, if you're a deer or whatever, that means a predator. For us, that gets that danger signal gets stimulated when children are looking on social media and they see something that either criticizes them or they think, oh my God, I'm going to be shamed at school tomorrow. Sure. Any of these things, our fight or flight response gets triggered time after time after time after time during the day through these interactions, and especially in now with COVID going on, it's worse than ever. And the thing about that is that our body is not designed for that. And what it means is that all these stress hormones that are pumped into our body as a fight or flight response are lingering, are staying there. And there is innumerable studies to show how bad this is for us, both psychologically and physically. And that's the issue. And so, yes, I do think that if social media is increasing stress in terms of kind of concerns about shame, concerns about identity, which is, if children are using that or young people are using that to kind of at a point where their identity is very fluid anyway, and they're trying to find their place in the world, it causes an awful lot of fear. And I think that the fear response is what we need to avoid. Now, whether policy can react to that, I don't know. I mean, I think the problem is that policy will always view itself as being reactive. Nobody wants to invest so that the government in 20 years' time benefits. So it waits until it sees what is necessary to react to, which is where I think it's going to have to be social policy. Rather than it's going to have to be social policy to kind of introduce, to make a wider use of the idea of well-being. The idea of well-being being something that is absolutely important to us. But then that butts up against economic policy.
Yeah.
They want people to work hard. And unfortunately, that's not always compatible with mental health either.
No, and I think it's a fundamental flaw with our system that we view policy focused decisions in that way, and it means, like you say, we're not making decisions based on the best thing for the greatest amount of people. As you say, governments don't want to make it easier for opposition governments in the future, and there's maybe not a humanity focused approach to a lot of these issues. I don't think that looking at this issue through the lens of the economy is the best way to provide solutions for people that are struggling. Would you say that to maybe go back to young people and social media, what are your thoughts on young people's access to social media, smartphones? Is there an age that you would say maybe these things should be restricted to 16 and over, or
No,
because it's
I don't. I mean, I don't agree with restriction because it's impossible. It's absolutely impossible. I think the opposite is education. I think education is very, very important, and psychological education too. I think this is where it actually becomes provision. I think it's starting in schools about normalizing our reactions to social media, because it's not social media per se, it's our responses to them. It's our responses to I guess those things when you're looking online and you're seeing other people having a great time and you're not invited, and understanding what that means, and understanding why people post certain things, understanding that Facebook is not a reflection of the world. It's a creation. It's a falsified reality. And understanding, and I think helping children to recognize to recognize that they can turn it off, to recognize that we've moved into a globalized world that isn't necessarily good for us, and in fact, is proving, a lot of things are proving that it's incredibly bad for us.
Yeah. I was going to say, I think it's difficult though, isn't it? Because these, especially social media companies, are developing programs that are made to create addiction. So for them, the last thing they want to do is provide more education as to why people shouldn't be on their platforms, because it's not going to make them any money. And I think that there's two forces fighting against each other, isn't there? There's the private financial incentive-driven force, and then there's this sort of more societal force that's saying, actually, we should probably slow down and think about these things a little bit more. I don't know if you've seen the documentary The Social Dilemma.
I haven't. It's on my watch list. I do want to see it.
And it does tackle this issue. It's very good, and it's changed my way of looking at this issue. I think I trusted the social media companies to be responsible enough to fix these issues too much. And that's why, from my perspective, and I tend to always look at these issues from a policy standpoint anyway, just because it's my background. There needs to be more. I personally believe that there should be more intervention from policymakers, from government, because I do see there being the dangers that won't be tackled by the private sector, these issues will just be perpetuated. I think.
Yeah, I mean, I think the education towards realizing, helping people realize that these things are bad for us, because you're absolutely right. I think the problem is that I think policymakers and the individuals that run these companies are always going to be locked in a bit of a battle. That the policy, it can be a quite slow moving beast, and by the time it's done it, tech moves on, and tech moves on and gets caught up in all sorts of kind of red tape about whether you can do this, whether you can do that. I mean, this is, the hard thing is that tech is moving so fast in the last 20 years. The policy struggles to keep up with it. Knowledge struggles to keep up with it. There are things, here in existence that it boggles my mind about how ubiquitous Facebook and Twitter and everything is, and when you look back and see when they were actually launched. And and I feel like they've been here my whole life. I'm 50. It's bizarre. So I think the problem is that they move very, very quickly. So policy always struggles to keep up with it. I mean, as with most things, I mean, I think a many-pronged attack would be the right approach.
Of course.
I think educating young people about the damage of this stuff, educating it about the reality of this stuff, about the algorithms that present to you things that you're going to. I mean, just in terms. I mean, what's really interesting in political terms is the effect that Facebook is having on the political world, just by the algorithms that are reinforcing all sorts of confirmation biases and kind of basically saying to people, well, here's what you think. We'll show you lots and lots and lots and more things that support that evidence, rather than kind of saying, well, here's an opposing view or here's a different evidence around that. So I think, it really is twisting reality. And I think, for me, the solution is separate from it. I think, or use it with knowledge. That's what I'd like to be able to see people be able to do. And I think that that can help young people as well. God, it's tough for them at the moment. I think it's absolutely.
Brett, sorry.
I
wanted to ask you. Did you have when Brett went? For those that don't know, Brett grew up in France. I wanted to know, did you have availability for counselling in your school in France?
No, there wasn't. There weren't any counsellors at the schools in France. I don't know if that's changed at all recently. And I did think just before we started this podcast that I should probably have done a bit of research into what it was like in France. But I remember going to see a child's psychologist when I was in my teens, and finding it a horrible experience because I think I only had like 2 or 3 sessions, but I just I didn't really want to go in the first place, but was kind of. I think it was advised by my GP. So my parents took me, and the whole experience was basically just being put in this quite cold office with this man that I didn't know, and him basically asking me to sort of recount my life without really saying anything and just sort of taking notes. And then the week after, he'd pick up where we left off, kind of thing. It was a bit. That's my only.
Cold.
Yeah, it's my only experience of
Right.
of mental health services in France. So I don't know if they are any different now. I would like to think they are. To go back to sort of the availability of services in the UK, you've mentioned education for sort of the younger generations would be ideal in trying to change how we view mental health, but for now, what the NHS to me doesn't seem like it's particularly in a good state to provide much mental health support. And any experiences that I've heard of from other people, because I haven't actually sought any help from the NHS, from what I've heard from other people, isn't very good at all. They sort of have come away saying that they had to wait weeks to hear from anybody, that they had to go after being referred by their GP, or that their issues weren't considered important enough to even require support. I don't know. In my mind, I think sort of psychologists, seeing a psychologist like yourself is the best way to get help, but it's not really. They're not really that accessible to people, given the price, I think. What would you do? You think that private psychologists maybe should be funded by the NHS, or? I suppose it's a difficult
Yeah,
question since you
no,
are
yeah.
in that industry.
I think the difficulty is that there is a greater need than supply. I mean, that's always the case with the NHS. I think the fundamental issue is under provision. And I used to work in the NHS, and part of the reason I left is that I didn't feel we were actually providing therapy to people. I believe that what we were doing was trying to find a way to meet deadlines, meet waiting list target times with the limited resources that we had. And so what was happening was that we were getting spread more thinly. People get less session time. It was focused around as long as somebody had a kind of face-to-face meeting within a certain time, then waiting times were met. But the well-being of that person wasn't the prime focus, and this is a policy thing. This is not about the people who work in the departments, because they are wonderful people and they work incredibly hard. So no, I think provision is very, very poor, and I think that as with anything, if it was properly funded, there would be it would make a huge difference, because essentially people really only it is awful for people, because people really only do really access mental health services when they're pretty much in crisis, when they literally can't take anything else, and they need to be seen at that point. At that point, that's where they need to be seen. And unfortunately, the idea of waiting lists, it's utterly pointless. I mean, usually people will have, been suffering terribly for a couple of weeks before they even go and see their GP, and then they go and see their GP, and then they get a referral to mental health services, which they then wait for, and it can be months before somebody is actually sitting in front of a psychologist. And so, I mean, I guess in dealing with the reality that unfortunately mental health services within the NHS are always likely to be underfunded, I kind of feel that outside education is what we need to help people.
Sure.
Yes, there is always going to be times that people need to see a professional, but I think there are a lot of times that that people come and see me and are in crisis, and one session helps enormously to be able to explain to somebody that what they're going through is normal given their experience. That helps enormously, because when people are in crisis, they're terrified. They're absolutely terrified. They're terrified they're losing their mind. They don't know what's happened to them. They won't have felt this way in their life. They have suicidal thoughts, which they've never had before in their life. And sometimes what's needed is a bit of reassurance. I also think there's something about demedicalizing it. I think there's something about actually some people just need support. Some people need to, I think there are ways to humanize contact, because I think that an awful lot of the time, what we need as humans, as kind of descendants of primates, is we need other people. We are absolutely useless without human contact. We're social animals. When we're born, we can't function without another human. So we are intrinsically bound to other people. And I think, instead of kind of medicalizing these things as people who need treatment, maybe we just need to think about, well, maybe we can, at a smaller economic cost, maybe we can just have people who can be a support, who can be them.
I'm very much of that mindset now. I think I've told Jack about it before, how I think that the sort of stigma around getting mental health support shouldn't be there. It should be normal, completely normal, to go and seek help, or just even have somebody to talk to that can provide a bit of an outside view. And you don't need to, even though we have spoken about how people who are at that tipping point definitely need help as soon as possible, it shouldn't be looked down on to go and just see somebody for the sake of wanting to vent or to talk about just things in your life. I don't think.
Yeah. I think what the thing that gets to me the most is that we've created a society where simultaneously life is more and more difficult, particularly for those that are poorer, and help and support is provided, or is still really difficult to come by. So essentially what we're saying to people is, your life is really difficult. You're pushed to crisis point, as you say, before you can access this help. And then when you finally find the I think courage to reach out to these services and say that yes, this is something that I need support with, you're told, oh, we'll get to you in a few months. And like you say, it's not the fault of the NHS as an idea, and I don't even think it's necessarily a private sector versus public sector debate. It's the lack of funding and poor management of funds that means that those services aren't at the position that they need to be. And I think people are told, especially young people, are told that their lives are easier than anyone's lives have ever been.
There's a strange dichotomy there, because in some respects they are. In some respects, our healthcare, our provision of welfare security, these kind of things, they are better. But our belief is that they're not. The higher pressures on young people are huge. And this is the strange thing, is that in many ways our lives are better, and yet our beliefs are that they're not, and they're not because of the pressures that are put on us. One of the things that really concerns me is the effect of the sort of demands of kind of teaching league tables and the demands of children to tell as soon as they are 10 years old, they're told, these SATs are really important, you've got to do this. And actually, they matter nothing. They matter nothing in the scale of somebody's life and what they can do and who they're going to be. They don't matter. And yes, I think the unfortunate thing is, and I think this is where social media comes into it as well, I think it just increases the pressure. Yeah. That's the stress is the absolute, the absolute massive problem with mental health, and we have more stresses on us than ever, when actually our lives are we're very safe, really, compared to how we were 250,000 years ago.
Yeah, of course. Yeah, I remember during my GCSEs and A levels being told by teachers, this is the most important time of your life. You need to make sure that you're striving to achieve everything that you can do, because these are the most important exams you're ever going to sit, and they're going to shape your life through the rest of your future. And it's like, what I really needed to be told there was, it's important, these exams are important, and if you do well, it will make your life easier, but if you don't, it's not the end of the world. Everything will be okay. That's what I need. That's what I needed to be told by teachers. And it's like you say, it's maybe miseducation. Not saying that their heart wasn't in the right place when they were saying that to me, but it's probably not what the message that I needed to receive. And for some people it might work, and for others it clearly doesn't.
This is the crazy world that we do live in. Those poor teachers are standing there, and the reason they're saying that, if they were brutally honest, is kind of my job depends on you getting these results. And they've got a head teacher who's then flowing the stress down, saying my job depends on you teachers getting good results, and so on. And it goes, and unfortunately everyone just flows the stress down. And you're right, it does take a circuit breaker to say it doesn't matter. None of this really matters. One of the things that I always say, for young people listening out there, I made a complete arse of my first A levels. Honest to God, I didn't bother. I didn't do anything. I went back, while I was kind of a gigging musician, I went back and did night school and did my A levels again. And I didn't do my degree until I was, I didn't start my degree until I was 40. So, these things, it's really, really important to say that these provisions are there. It doesn't matter if you're 17 and you don't get your A-levels, or it really doesn't. Life isn't about that. And I think that's the sort of pressure that we need to take off people.
Yeah, and I was probably lucky in that there were a couple of teachers, particularly at A-level, that did say that, and did have similar experiences where, they came to find their vocations later on in life, and that message is, I think, as you say, incredibly important.
Well, especially for young people when now, longevity is increasing, and it used to be that these messages came that actually, your lifespan was fairly short and you had to get started on a career early and get into it if you were going to build to a place to save for your retirement. But, our lifespans, the expected lifespan of people being born now is probably something in the region of the 80s. So it's a case of, well, actually, you can have 3 careers in that space of time.
Yeah.
You've got more time than you know what to do with. So actually, you'll be okay. And the good thing about the wonderful thing about living in this country certainly is that we have a welfare state that will support you, that will support you in education, not to the extent that we might like, but it is there.
Yeah. Just before we move on to current events, I assume, Brett, do you have any advice that you would give to younger people who may be struggling with their mental health? Any way that they can reach out, anywhere they can reach out to, or any advice that any advice that you might want to give them?
One thing I would say is try it. I would say try to get in touch with a counsellor, with anybody. If you're just struggling, you're not sure, just try it. The other thing I would say is for me, I actually think that provision in the National Health Service is a struggle, and yes, you should probably try that route. But if you can access privately counsellors, psychologists, whatever, give it a go, because it's better soon. It's much better sooner than later. The sooner you do it, the sooner, if you're not sure, just go and just try it. And the other thing is that don't believe, if you go and you don't have a good experience, don't think that that's all counselling. Counselling is very, counselling, psychotherapy, psychology, it's all based on the relationship. And sometimes you have people who you just don't get on with, who you don't see eye to eye with, and that's okay. So, try a couple of people. If it doesn't work, if you don't get on with them first time, you will find somebody that you feel gets you and you can feel comfortable with. But I would say just give it a go. Try it like an experiment. Treat it like water skiing or skateboarding or something. It's kind of like, give it a go. You might hate it, you might absolutely love it. But I think earlier the better. If you leave things, they tend not to get better. They tend to only get worse. So if the other thing is about the stigma, only tell who you feel comfortable telling. That's the thing. If somebody that you trust, talk to them, ask them to help you find somebody. Access is available, and if it's a cost thing, there are plenty of therapists out there. We hopefully we can see ourselves as good people, and there's low cost options out there. A lot of people will kind of see people, if they're struggling and they can't afford much, they'll make concessions. So yeah, consider it. I would say that the NHS is the first port of call for people, but actually do consider private work.
Yeah. And if you are at a crisis point, there are plenty of charities and helplines out there that will provide good services. And I don't have any off the top of my head, but I will put some in the comments for people who might be struggling and do want to contact somebody ASAP.
That's a good idea. I mean, I think that Mind Online, Samaritans is always very, very good for people really and emotionally distressed. Just to talk, Samaritans is great. But the bottom line is that if you are struggling, if you're worried, make sure you also, alongside this, you get an appointment with your GP, because that is the first protocol, because there might be something physical, and they can also help immediately with medication, and some GPs are very good. The other thing about it is that, you know, not all GPs are the same. Some are far more interested, far more trained in mental health. So, you know, make sure you get the treatment you want from your GP.
Mm-hmm. Moving on to current events, I feel like we need some kind of jingle, Jack, to move between segments.
Current events.
That's perfect. Yeah.
There we go. Yeah, we'll clip that. So the first current event we're gonna cover is the Biden-Trump debate that happened the other night. So we're recording this on the 1st, and this happened a couple of days ago. Yeah. Jack, did you want to give a quick rundown of what happened?
Yeah, I mean, it was the first debate of this election, and I think a lot of people thought that this was going to be a bit of a spectacle. I don't think anybody really knew what was going to happen, and the unpredictable nature of this election and of obviously President Trump meant that it was probably going to be something worth watching. I watched the debate. I've watched it twice just to prepare for this.
Have you? Did you watch it live?
I didn't, no, but I watched it the morning after, and then I watched it last night as well. And the thing is with political analysis, and there's a US political commentator called David Pakman, and he was summing this up, and he was saying that when looking at this kind of thing, we tend to try and use frameworks that we're accustomed to. The problem with this is that it was such a bin fire that finding a framework to use to analyse it is pretty difficult. Like, if we just say, oh yeah, it was a terrible debate, that doesn't really do justice to actually how awful it was. And I think that kind of that sort of sums it up in many ways. There was not really any substance at all. Donald Trump spoke over both the moderator and Joe Biden constantly. Joe Biden had some moments where he spoke about policy, but there weren't loads. He often struggled to put together an argument in a way that was easy to understand. And Trump insulted him throughout, personally attacked not just him but his family, his son, who has had a drug addiction in the past. He attacked his son. He also he was asked whether he would denounce right-wing extremist groups, and instead of telling them to stand down and not inflame tensions more, he told them to stand by, which I believe a lot of right-wing militia organisations have seen as a call to arms, effectively, to say we need to be prepared for this election. We've been told by the President of the United States to stand by if anything happens. It was, I think, that the American experiment, if you will, has been failing for a while, and this kind of encapsulated that failure. It was in no way a democratic debate. The moderator had no control over it whatsoever. And I think a lot of people, the main thing that I've seen is that it was an embarrassment to sort of US democracy and to the US people. So I don't know if you maybe thought it was more substantive or constructive than that, but I think this shows that the direction that politics is going at the moment, and the kind of tribalism that we're seeing, and how dangerous it is for democracy.
Simon, did you see the debate at all?
I saw edited highlights, so
sure.
I really couldn't face. I mean, well done, Jack, for sitting through the whole thing, because it was just. I mean, I think, you know, I agree with everything that you said there, and the problem is that, you know, really in that situation is the personality of Trump. And the difficulty is that essentially that's pretty much all there is to Trump. You know, I mean, this is somebody who has essentially come from sort of a very moneyed background and has had a history as a TV personality, and that's what you get. The thing that surprised me most about Biden's advisors is that Donald Trump is and I kind of feel I can do this now because his own niece has kind of come out and said it, but Donald Trump is the poster boy for narcissistic personality disorder. I mean, he is absolutely nails all those the symptoms, and the problem is that those people are extremely dysfunctional, and you can see that in the way that there is an absolute lack of empathy. There is an inability to listen to other people's realities. There is the the talking over people, and I think for me, Biden needed to have looked to that really more than anything else, because attempting to engage with a narcissist, you can't do it. You absolutely can't do it, and I think he was very, very badly advised to go in and try and do this. And I think he would have been much better advised to talk about those personality traits, to be able to, because there's a fabulous book I read called Commander in Chief, which is it says Why Golf Explains Trump, and it's a fabulous book because Trump is obsessed with golf, and I'm a fanatical golfer as well, and so one of the fundamental things that Trump is obsessed with is winning. Everything is about winning for him, and the concept of being on top. And I think if Biden was able to point out that to recognise that actually that is a fundamental personality flaw, that he will prize winning over what is for the greater good, or what is right for the American people. The first in his mind is Donald Trump, and I think that kind of they sort of walked into Trump's battlefield. They kind of they both of them sort of it's like, I wondered, have you not seen what he's like over these past 4 years? What did you sort of expect when you went into this? That he will talk over people, he will dominate. You expected him to play by the rules? Well, he doesn't. Yeah. This is a man who out and out cheats at golf. Which is just, and anybody, I know it kind of sounds trite, but anybody who does that, has no sense of personal responsibility, has no sense of ethics, of integrity, and I think that's what they've got to realise, that's what they're dealing with. And I do wonder whether for the later debates Biden might change his tack, into how you can't debate Donald Trump. There's no such thing.
Yeah. And that was what was really lacking in this debate, was the control over him. And one of the analogies that I heard, and I think it's similar to the golf thing that you mentioned, was that if there's a boxing match and one fighter is blatantly cheating, you have a referee there, and that referee is there to penalise. You set out rules, and that referee is there to penalise the fighter if they break the rules. Whilst there was supposedly a referee at this debate, there were no rules that were outlined as to what you can and can't do. It was far more about making entertaining television than it was about having a constructive debate that helps the US people pick who is going to be better at running their country. His mic should have been muted probably 20 times in that, because you can't have it that Biden starts to speak and then Trump just shouts over him. The moderator couldn't take control. He couldn't shut him up. And you have to then say, okay, there are lines that if they are crossed, we're going to do something about that, if you're serious about having a constructive debate. But I think you're right. I don't think you can engage him in many ways. And there were a lot of people that said Biden shouldn't debate Trump, not in the sense that he shouldn't get up on the podium with him, but he just should ignore his existence. Because I think that would annoy Trump a lot more than anything else.
That is the one. That's a perfect solution, because that's essentially how you deal with somebody who suffers with narcissism that badly. Is that the only thing you can do is disengage from them. As soon as you start to engage with them, they will force their reality onto you, and they will not stop. And you could see that with the moderator. So the moderator. as soon as he sort of tried to say, please respect the respect the debate, Trump turns on him. And the tweet in the last few days is, we need a better moderator.
Yeah.
This is everything is just turned outwards. I think it's a really good idea to just say, look, I'm going to ignore this guy because this guy is massively dysfunctional. The scary thing is, for democracy, is this wasn't a secret, but people vote for it. This is what frightens me, really. We can blame Trump, we can look at Trump, and we can sort of say that he's the problem, but actually the problem is that this is no secret of his personality. This is a guy whose statements made before the election were abhorrent, and people still voted, and that is a confusion to me. That's kind of that when it becomes about politics of personality, really, and that's sadly where we are, I think, at the moment.
Yeah, I agree. How did you find it, Brett?
I also only watched highlights, like Simon was saying, but I kind of I'm of the same mind that I was sort of more embarrassed for Biden than I was for anything, because it was baffling to see him getting wound up by Trump and letting himself sort of get into that situation, rather than doing what I thought they would do, which was ignore him or I wouldn't be surprised, like Simon was saying, if we see a very different approach to the next debate from Biden.
Yeah.
But it was just embarrassing.
There were some things that Biden did quite well to combat some of the stuff that he was doing. So he was laughing a lot.
Yeah.
And that was one of the things that I noticed. And I don't think that was planned. I think that was natural.
Mm.
And I think that worked quite well. You could see Trump get a little bit more uncomfortable when he would say things that were just completely outrageous, and Biden would just laugh at him in sort of a pitying way. But yeah, I mean, some I don't like Biden as a candidate at all politically. However, this has really reinforced in my mind the need for in my opinion, for him to win, because I think a lot of the it's not even really dog whistle extremism or racism that came out in this debate. It was just upfront racism, and I worry whether this will end peacefully, especially when you have the president inflaming these tensions.
This is one of the most frightening things, really, is about the fact that and this goes to this kind of obsession with winning, is that I don't think it is going to end peacefully, because unfortunately Trump is not going to be able to handle losing if that's what happens. And I think this frightening thing about kind of, I want people down the polls watching, this kind of euphemistic word he describes, watching, get in there and watch. This is a really, really frightening. This is frightening. This is kind of dictator type
absolutely
kind of behaviour around voting. And that's absolutely terrifying. That's really terrifying. So, I hope, I'm the same. I just hope Trump is removed, and it can be just a footmark in history of kind of people. The American people can look back and just say, what were we thinking?
Yeah. Well, that was straight up calling for voter intimidation. That was, which it's completely illegal. You can't just go and stand outside a polling booth and watch and ask people who they're voting for, and with your Trump hat on and maybe armed. A lot of his supporters now are walking around armed. That is stuff of authoritarian states.
Yeah. I saw some counties saying, clearing up that statement afterwards, saying that people would get arrested if they did that. Yeah. But yeah. Shall I move on to the next topic?
Sure.
I don't know if either of you got a chance to look at the article. It was quite a brief article.
Yeah.
It was an article in The Hill which was talking about, it was titled 90% of coronavirus patients experience side effects after recovery. And basically they had done a survey of almost 1,000 people and found that 9 in 10 had reported symptoms of fatigue, loss of taste and smell, and psychological issues after recovering from the virus. It also spoke about sort of other lingering side effects that might can be more long term and concern physical health, like I believe they mentioned heart inflammation and damaged lungs, and that's those sort of those sort of health problems. Does it worry you guys at all? Because for me, I think the main concern about not catching coronavirus was so that I wouldn't pass it on to vulnerable family members or friends.
Yeah.
But that makes me slightly more concerned for my own health to hear these kind of reports.
For sure, and I think the message that needs to be reinforced is that whilst deaths are thankfully still at a fairly low level, it doesn't mean that there's no risk attached to getting coronavirus. Of course, it's important to have all of the precautions in place and not pass it on if you do get it. But that also doesn't mean that you shouldn't be at all worried, especially if you're a young person, about contracting it, because that's what I think we've seen. Unfortunately, some people not being worried because it's I'll just get over it. Well, that doesn't seem to be the case for a lot of people, and it's clearly still in circulation. We don't know really too many details about the long-term effects. They could be better than we think. They could be a lot worse than we think. We don't know. So, still telling people to be as cautious as possible and really, really try not to contract it, obviously, is important. And we spoke a couple of weeks ago, Brett, on the podcast with Leo Quartermain about going to the pub and going out, and I've actually taken the decision now not to do that anymore, because I went recently and it was just ridiculous. And I kind of made the decision early on when things reopened again that I valued the social interaction with people, meeting up with my friends and going down the pub and everything, as much as, or sort of at an equal level as what the risk of me contracting the virus would be. And I've changed my mind on that now, and I really didn't feel comfortable the other night with what was going on. Lots of people not following the precautions, lots of people mingling in large groups. It didn't seem safe at all. And then this, on top of that, I think, there's other ways that you can interact with people, and we just still need to be really, really cautious.
Sure. Yeah. Simon, are you any more concerned?
Well, I mean, I think the difficulty is that we're in a process of discovering what this disease does, and I think the difficulty is that a lot of that we don't have the proper kind of epidemiology around it yet, because it's still unfolding. And so I think we go through these different media representations of what it is. Sometimes we can get it. You read kind of opinions that actually it's a relatively mild virus, and the consequences are kind of outliers. Some of these consequences are outliers. I think the problem is that we don't actually know, and that's one of the biggest problems with this at the moment, is that it creates a huge amount of uncertainty, which is very anxiety provoking. I mean, for example, when it kind of says when it said in the article about psychological issues, well, part of me thinks, well, of course it will. This goes to the sort of this goes back to what we were saying about kind of normalizing mental health. If you've had a brush with a possibly fatal illness, it's going to affect you psychologically. I don't necessarily think that that's something that that's the sort of thing that I'm talking about normalizing. That actually that's almost put down as something that you shouldn't be experiencing. Alongside heart inflammation and these kind of things. So I don't know. It's a really difficult one. I mean, I'm at a sort of crux point really in my thinking around this, is that it's really, really difficult, because I think we're starting to see the other damage. We're starting to sort of being able to tally up the damage that the prevention of the disease is causing, i.e., whole industries are gone. Livelihoods are gone. The arts is devastated. University students and not getting an education. You know, okay, it's there, it's there online teaching, but that's not all the education. I worry for children growing up in a world where we are made to fear other people, where we say stay away from other people, where people's faces are covered in masks. And I you know, I'm not saying we shouldn't be doing it, but I'm just saying it's a very I absolutely don't know what the right answers are, and nobody does, and this
of
is
course,
what, you know. But the fears about the long-term effects, I don't know. I think I would prefer to sort of wait and see what the overall reality is, because anything within a population, you know, follows a normal curve. So, you know, the fact is that there's often a bias that we will hear about the people who, through the media, we'll hear about the people who suffer long-term side effects. What we don't hear about is the majority of people who may come forward and say, well, I didn't suffer anything. You know,
Sure.
we don't speak to them. They're not newsworthy. So, you know, so it's I'm always very sort of cautious, I guess, around these things, and kind of think, well, we don't know the full picture yet.
Yeah. I think even in this article, it was saying that the report, the research that they were in the process of doing wasn't finalised, and that they were hoping to release it at some point in the future. So, yeah, like you say, it's also new still. So the knowing what the potential long-term health repercussions could be is probably a bit down the line.
Well, again, you know, and the other thing is that, yes, you know, this may be a case, but we're also very new in learning about treatments. You know,
Sure,
we don't know what works, and really, it's, you know, at the moment it's an experiment. You know, the sort of medics are trying this and trying that and trying this, and some things are finding a work. You know, they're finding that steroid injections work very well to protect the lungs, and you know, previously at the outbreak of COVID, nobody knew what to do. You know, the only thing we had was ventilation. But as time goes on, yes, these long-term effects, we're finding them now, but hopefully there will be treatments developed that will prevent these long-term effects as well. So,
that's a good point.
There's a balance to it.
Mm-hmm. Yeah. Shall I move on to quickfire questions now? The final segment. We need a jingle for that as well. So these questions are basically just that they're some of them are political, some of them are just for fun. The first one that I've got is quite a heavy one, and it's following my theme of asking a question that really can only be answered by with nuance.
Right.
But the question
a quickfire
is
question that can't be answered in a quickfire way.
Yeah, that can't be answered as a quickfire. Yeah, it's does multiculturalism encourage or discourage racism?
Oh my god, Jesus Christ! They're getting heavier and heavier every week.
I know.
Shit.
Yeah.
Okay,
I was impressed with my question, but at the same time,
I'm gonna say discourage.
Yeah.
Because I believe the best way to combat racism is through experiencing life alongside people that are different to you, that have different backgrounds and experiences. I think that where we see racism fester the most is probably within, say, let's take the Ku Klux Klan in the south of the United States, when you are in these small communities where those ideas are the only ones that are circulated. You're blocked off through experiences with other people that are different from you, particularly really positive ones. And the best way to break people out of those cycles is by increasing your exposure to people that are from different backgrounds that you get along with, because you see them as being human beings. That would be my quickish fire answer.
I totally agree. And to answer it from a quickish fire answer, to answer it from a psychological perspective, one of the things that's one of the most famous sort of experiments in psychology is what's called the minimal group paradigm, which basically shows that if you put people in an arbitrary group for no other reason than they are a member of that group, they will favour that group over another group. So you know, the famous experiment was kind of done with children on a school day out, and they were divided into groups on the basis of who liked one painting over another. And at the end of that day, there was a kind of a an allotment of resources. So it was basically give out sweets, and those kids would prefer to give out sweets to that group that they were in during the day rather than their friends who were in another group. So what that essentially means is, so when we're seen as one group versus another, there's a tendency to favour the in-group. That result is mediated when you introduce a third group. So if you introduce a third group, that result disappears. So people don't necessarily have that favouritism about their own group. So it's really a kind of an us versus them thing.
Yeah.
So I think pretty much what you're saying, Jack, once you introduce multiculturalism, it reduces the us versus them effect.
Yeah.
If people can be seen as the same, as part of the same community, as part of the same friendship groups, a diverse group, they can. I would hope that it reduces the us versus them effect of racism.
Yeah.
Yeah, very good answers.
Thank you.
Thank you.
My next question is way less heavy. It's when would you ideally like to start seeing Christmas products being sold in shops or supermarkets? The juxtaposition is it's quite big.
Mid-November? Is that too late?
Too late. Anything appearing before December. Seriously. Well, apart from advent calendars, which obviously have to be pre.
Yeah.
Okay, so advent calendars last week in November.
So that counts, right? So that's mid-ish November?
Absolutely, mid-ish November. For advent calendars only. That's
Right.
yeah.
How about decorations?
No, you don't need
yeah.
it. You don't.
You
no.
don't.
I drove past a house recently that had its Christmas decorations up but off. And I thought that maybe they just leave them up all year.
Oh yeah.
So they don't have to put them up again.
Well, the way some of these houses get decorated, the amount of stuff, that's what I would do. Definitely.
Yeah.
It's just not worth taking all that stuff down.
Yeah.
But yeah, I mean, the problem, I really like that people get excited about it, but the problem is that it lasts too long then. It's kind of like 6 weeks of Christmas decorations. It's not as exciting. It loses its thrill for me, and kind of, a concerted 2 or 3 weeks, that's enough.
Yeah. This question comes from my experience in Morrison's the other day, where I saw Christmas, products being sold on the shelves.
You hate it, don't you, bro?
I don't. What, Christmas?
Yeah, you're like proper Grinch.
No, I don't hate Christmas. I'm just a bit numb to it, I suppose.
Right.
I don't.
Do you think that's because of there's too much?
I think probably in part,
too
yeah.
much too soon, right?
Yeah, because it starts in if I'm seeing stuff on the shelves late September, and then I won't.
That's way too early.
And then they'll still be playing Christmas songs by mid to late January.
Yeah.
That's a long.
Speaking of mental health, I mean, how people working in these shops manage on a diet of one CD playing Christmas songs over and over again. That's torture.
Yeah.
I worked in Next for about 2.5, 3 years, and I still remember to this day the music that they played, both at Christmas and not at Christmas, because it was so repetitive. You were hearing it like 5 or 6 times a shift.
Oof,
and it is torture.
Mm-hmm. Yeah. That should be a form of torture if the FBI are looking for a new type. But yeah, I think I'd probably say December as well. Anything before December, other than maybe advent calendars. Yeah.
Right.
I'm just not the biggest Christmas fan generally anyway. So my next question is: should Heathrow have another runway?
No.
I agree.
Yeah, I also agree. That's the quickest question.
For a reason, this is really interesting because this ties in for me to coronavirus, and one of the things that has not been said is I guess it probably has, but I haven't read a lot about it. Is the industry's culpability in the spread of coronavirus, and this is one of the things I mentioned earlier on is the issues of globalization, and something like coronavirus, it has a 2 week extinction window, and normally without airlines, you would to cross a sea or to cross a mountain range or travel across land, it would be gone, so it wouldn't travel outside its kind of inception zone. Mm-hmm. You stick people on a plane, and 9 hours later they're all across the world. So I think even if there were economic arguments for it beforehand, I think they are absolutely and completely gone. And I think we need to be looking at saying actually the aviation industry is not a good one.
Yeah.
Yeah,
It's the issue for places like New Zealand that got rid of their coronavirus cases and then had was it? I actually don't know what the situation is over there now, but a month ago, they had the 2 British people fly over and bring it back.
Yeah, exactly.
Yeah.
And if global pandemics are going to be an issue of human life going forward, we need to think about what we do with sort of free for all global flights. Are they a good thing, or do we need to just actually say no, sorry, aviation industry, you don't have a right to exist?
Yeah. My next question is red, white, or rosé wine?
Red.
Rosé, although I'm not big on wine, but if I have to drink it, I'm rosé.
See, I'd say white. That's
look
quite
at that.
Really?
variety there, yeah.
We can all have a bottle each.
We could.
Would
yeah.
you'd really say white? Bro?
I would, yeah. I find it
Is
way
that-
easier to drink.
Are you in some way? Is that like going against? Is the French?
Well, the Bordeaux region.
Yeah.
Yeah, definitely. Yeah.
Yeah.
It's known for its red wine. Yeah, so. But I like red wine with food, but to drink on its own, I find difficult.
Right.
And
But
rosé wine, I'm not a huge fan of.
Always a pint of ale over wine.
See, if I said that, then I definitely would be betraying my French
Yeah,
roots, so.
for sure. Yeah.
My last question is, if you could pick any mythical or fantastical creature to exist, which would it be?
Oh wow, good question.
Yeah, it is. Sometimes these are too good because they require some
Thinking, yeah.
thought. Yeah.
Yeah.
Do
I think
you know what?
for-
The first person that came to my head was Mr. Tumnus. Now, I don't know if I want that to be my answer, but that was the first thing that came to my head.
Wow. I mean, I'd love, for the pure spectacle of it, I'd love for dragons to exist.
Yeah.
But obviously, it'd probably be quite disastrous.
I mean, I always go with something that I think is possible. Something like a griffin, that you think.
Oh yeah.
That when you see something like a griffin, you think, well, that actually could exist. When you see
Yeah.
the things that we have, you think
Mhm.
you look like emus and kind of
Yeah, yeah,
giraffes and things. You think, well, why wouldn't a griffin exist? It's kind of.
Yeah. I saw a tapir at a zoo recently, and they are basically just other animals merged together. So yeah, a griffin could perfectly exist. Yeah.
I also think that, like, with all these mythical creatures and people talk about aliens and that kind of thing, it's like there are some, like you say, some crazy things that exist.
Yeah.
Have existed in history, exist now.
Yeah.
Sea creatures, especially like jellyfish and octopus and stuff. Like they're wild, like, literally, and also
Yeah.
in the slang sense.
Well, the platypus is just incredible. It's just,
Yeah.
what the hell is that thing?
I don't know. It's so strange. It's got it's the only venomous mammal, right?
Yeah,
I think.
venomous mammal. It's any mammal that lays eggs. It's got
Eggs,
it's got a beak. It's just like, what the hell?
Yeah. There's a subreddit called, I think it's called Nature Was Metal, and it's just got it's got pictures and evidence of various prehistoric animals that existed that are just mind-boggling. Like one of them was like the great penguin, and it's just like a 9-foot penguin. It's crazy.
And who wouldn't want a 9-foot penguin?
Exactly.
Yeah.
More to cuddle. Or get squashed by.
Yeah.
Anyway, thank you for coming on, Simon.
You're welcome.
So
You're
much.
welcome.
Really
It's
good.
been hugely
It's been a pleasure
enjoyable.
speaking to you.
Not at all. Thank you for inviting me.
And thank you, Jack, as well, for coming on, as always,
No worries.
providing ever insightful
I
comments.
try.
If anybody wants to contact us to get in touch and talk to us about anything we've covered in this episode, or if you just want to send in some articles for us or be on the podcast, please contact us on social medias at Demographica UK. Also, feel free to contact us at our email, which is info@demographicauk.com. Also, please follow us or subscribe on whatever platform you're listening to these to, so we can get an idea if people are actually enjoying them.
And so you never miss one of our episodes.
Exactly,
either.
yeah, you'll always know. And we've got quite a few coming out at the moment. So, actually, no, this will probably be the last of the batch, won't it? Never mind. But for next week's one, you'll know as soon as it's out. Anyway, thank you again, guys. Thanks, everybody, for listening. And we'll see you on the next one. Bye.
Thanks. Bye.